The innovation market space I have been focused on is the Canadian nonprofit sector, which research suggests is the second largest in the world and is increasing its appetite to embrace technology and data availability to collaboratively prototype new innovations to persistent social challenges. The macro environment is the Ontario Autism Program, which is being redesigned to better address the increasing complexity and prevalence of autism that has risen by over 120% in the last decade alone, to include over 40,000 children. Increasing research, media, and advocacy are accelerating the demand for systems transformation. The competitive environment is the Toronto Autism System, in which my organization, Surrey Place Centre, is the single point of access and lead agency for children's autism services, in partnership with 5 other community organizations. Toronto is also a high-profile community in which the majority of advocacy occurs. The research conducted for this project to date includes 15 research reports and 18 expert interviews, which suggest that the autism system can be viewed through a lifespan of individuals. Before the age of 2, awareness of developmental milestones are needed for early autism detection, diagnosis, and supports. Before the age of 3, developmental windows need to be maximized with the appropriate types, dosage, and duration of evidence-based supports. Before the age of 5, children need to be effectively transitioned into school with their treatment supports being appropriately modified and integrated. Before 18, youth need to be effectively transitioned to a differently structured adult system through proactive planning. Over 18, the goal is for individuals to excel in education, work, and independent living by promoting health and well-being. While the individual with autism has significant needs, the support systems around them are also in need. Families and caregivers that need to understand autism, how to manage it, and make effective decisions. Support professionals and schools and adult systems that need to collaborate more effectively due to increased mental and physical health complexity. And policymakers who need more timely and reliable information to effectively shape the autism system. Given the significant systems needs, our vision at SPC is to transform the Toronto autism system in 5 main categories that target priority stakeholder needs, namely, increase stakeholder engagement, leverage technology to enhance collaboration and systems transitions, provide wellness supports to families and caregivers, enhance existing supports for increasing mental and medical health complexity, and improve the collection and dissemination of important data, research, and evaluation to continuously improve the system. We are pleased with our results to date, having engaged and secured funding from 5 specific sources: the Ontario Ministries of Health and Long-Term Care, Children and Youth Services, and Community and Social Services. Also the Ontario Trillium Foundation and the Cressa Toronto Corporation. This funding will help us achieve our vision with medical clinics that can increase diagnosis and treatment, a user experience designer who can engage our stakeholders and inform the agile creation of online wellness supports, improvements in our electronic health records, and integrated technology-enhanced tools that support collaboration, transitions, and effective decision-making. We will expand our interprofessional supports in areas like occupational therapy, psychology, and communication. And we will enhance our facilities with playgrounds to support physical activity. Our next steps are to complete the implementation of these projects in 2018, including their expansion across our developmental services programs as well, to then evaluate results against our targeted outcomes, and then engage our stakeholders in continuous improvement. On the personal side of things, I'm also working on increasing my own consulting business in passion projects like this.